Big data is a new field where masses of patient information are going to be analysed and used in quite new ways, mostly for the benefit, in fact entirely for the benefit of patients. What we have to do is safeguard against the loss of that data, the misuse of that data, and also taking people by surprise about the way that data is used. The way that we can safeguard against that, well, actually there are two quite simple techniques that health data professionals can use, and one of them is anonymising the data. My understanding is that for many of the uses in the healthcare area where you're trying to establish trends and solutions for particular health issues, that anonymised data is all you need. There may be some cases where the data needs to be tied to a particular person. In that case, second simple solution, ask their permission. So in many cases it's not necessary to get too worked up about patient protection. Just use those two simple tests. Can it be anonymised? If so, do so, or ask their permission. It's important for people using the data to understand that every tiny piece of data is about an individual person. So that data has to be treated with respect, and probably the biggest piece of advice I would have to people using big data is to build in privacy from the ground up, take on privacy by design. If you're treating your customer with respect, your patient with respect, that will be a really good test as to how you're going to provide for the use and access to that data. Privacy can actually be your friend if you're in the health data field. If you get the privacy right, you will almost certainly have got all kinds of other ethical and use aspects right, because you will be treating the subjects of the data with the respect that they deserve.